What does infection have in common with major surgeries? Join me for the next couple of minutes and you'll see. Surgical rooms have strict processes and procedures to ensure a sterile environment. Infection control methods involve ventilation systems, type of flooring, and the number of people allowed into the operating room. And that's just the beginning. What are some of the ways operating room staff try to maintain a sterile environment? Let's take a look at a few recommendations. InfectionControlToday.com. First, if the surgery begins with the scrubbed person sitting and is completed with the scrubbed person standing, the portion of the gown that was considered sterile is uncertain. And here's another one. Scrubbed personnel should remain close to the sterile field without wandering around the room. This movement can result in contamination of the sterile field. What happens if a sterile packaged item is dropped? The impact can cause the sterile barrier to be penetrated by forcing sterile air out and allowing contaminated air and particles into the package. Infection control involves many other considerations. Sterility is essential to the patient's safety. If the surgical environment is modified, the patient can become vulnerable to serious disease. In 1988, Dr. Augustine invented a warming device for keeping patients warm during surgery. Warmth reduces the risk of hypothermia and improves the recovery process. The method is widely accepted. Bair Hugger warming blankets suck in clean air while warming the air around and against the patient's body. However, a heat exhaust is created which sweeps down below the operating table where unclean air often lingers. The exhaust stirs the air and causes germs to rise above the operating table. In prosthetic surgeries, germs can settle directly on the artificial joint. Within seconds of exposure, they can begin adhering and anchoring to it. The germs then insulate themselves from antibodies by forming what is called a biofilm. Once that happens, the body is unable to fight the bacteria because the immune system is unaware that an infection looms. The malicious bacteria multiply inside their cocoon-like protection. As the biofilm matures, parts of it can break off and attach elsewhere in the body, spreading infection and causing chronic illness. This final stage of the spread of infection might not occur until months, even years, after the Bair Hugger's heat exhaust stirred up the bacteria and allowed it to settle on the open wound during surgery. The fateful delay leaves the patient completely unaware that the infection had anything to do with surgery. To make matters worse, many patients must undergo revision surgeries to combat problems caused by the biofilm infection. The problem is compounded when neither doctors nor patients were told of these potential problems. Given recent scientific evidence, the manufacturer of these warming blankets may be held accountable and victims who have filed claims may be eligible for compensation. To learn more about the Bair Hugger warming device, visit our website, lawyersusa.com/blanket. And if you would like to speak to one of our team members to find out whether you might be eligible to file a claim, call our law firm's Defective Product Department today, 888-LAW-8500.